Hey, everybody. Thanks for joining us tonight. I know it's a different night, but we didn't want to skip. So let's go ahead and open up to whatever guys want to talk about. Q&A. Unmute yourself, type in, but anything goes.
And go ahead, Chris, then Jennifer.
Hey, Chris.
Oh, hey, Greg. Thanks, Sam.
Hey.
Hey, I think this is a quick question, but just want some advice on
Sure.
for someone who is using recreational mushrooms, probably
Okay.
monthly or every couple months.
Okay.
So there's a
Do we know
thinning.
how big? Do we know how big of a dosage? Are they trying to, because there's these theories now, and where they do microdosing. And they use it to treat things like anxiety, something fear-based, even PTSD.
Oh,
But it's usually very small dosages. And so are they just doing it for, like you said, recreation, or are they
yeah,
trying therapeutically? Okay, gotcha.
I think so. And maybe, I don't know.
They're doing it for
I'll be guessing. Anyway,
yeah, we'll just say.
yeah, but
whatever.
anyway, there's so probably with that, there's some thinning of the chakra webs, which
Yeah,
may
there's
result in paranoia.
yes.
So there's some paranoia going on.
So there's a couple of things that can happen. And before I start rolling on that, you were the one that asked me about the emphysema last week.
No.
Okay, I thought somebody was asking me about emphysema. How to
Emphysema?
treat it. Yeah.
Oh, maybe. No, I don't think so.
Okay. Okay. So with mushrooms, we have a couple issues with something like that. Like if it's done in ceremony and things, it's like a little bit less of a gray area. But when they're doing it just for fun, I get it. But still, it does cause a couple of issues. So first issue is there's a little bit of a thinning of the web, but there's also it causes tears in the web, in the protective webs. A lot of times they're going to be a little bit on some of the lower centers, up on the forehead, the jaws, the ears, the ajna, it can be all over. You can go through and clean that up with pH, but when doing psychotherapy on it and cleaning up the web, electric violet, that whole thing.
Okay.
To thicken the web, best to use like gold. Essential oil wise, you would use poplar balsam, like have them inhale a lot of poplar balsam. And you could have them spray down with poplar balsam. That actually can be very helpful. But here's
just I'm sorry.
No, go ahead.
So would the spray work, inhaling and spraying, or
yeah?
Would the oil be
spray it on their hand and inhale it, and then spray it down, especially on like chakra to chakra. And then anytime there's a web issue, always spend time on the kidneys. And poplar balsam, again, just on the kidneys. It's very specific for this. The other thing that works for the kidneys and helping to repair the webs is also myrrh. Like if you have them inhale myrrh with their awareness on their kidneys, it actually will help repair the webs, regardless of where the tears are. It just starts like strengthening the web, and the web will kind of self-heal. Sometimes the webs do self-heal, but it usually depends on the health of the kidneys. With pranic healing, if you're trying to thicken the web, like when they've been thinned, some of the psychedelics do that, and also ecstasy does that, MDMA. And so like if they just do 1 or 2 times, I wouldn't worry about thinning webs. But when they are doing it kind of consistently, or have done it consistently, the webs do get thin.
I think they do it consistently, but not like every weekend or so.
Yeah.
Maybe every maybe every month, maybe.
Yeah. It starts to be about how many exposures there are. And with that, a lot of gold on each of the webs. Like if you go through and put a bunch of gold on, it kind of like like it thickens the web, like you thicken the skin, kind of like it just firms everything up. And so part of what happens is when negativity is projected to you, the web is like this, and then it tightens up and it pushes back, right? So when somebody is using psychedelics kind of on a regular basis, what happens is it not only doesn't tighten up when something negative comes in, it actually gets a little looser, right? And so what you're doing with the gold is you're helping to regulate it so that it gets back to that point where it's kind of normalized, and then when something negative comes in, it firms up again. Because that leads into what I was going to say next is the issue is when somebody starts doing it on a regular basis, they start opening themselves up to perceiving things in the environment that are always happening, but we have that web or that veil that kind of filters this out. And so for those of you who are watching and don't know quite what we're talking about, you have the surface of the chakra, right? And then it comes in like a V into the central channel. In between the surface of the chakra and your body is this like little filter. Like it's a filter that just keeps negative things out from the environment, and also things that you really wouldn't normally perceive. It just keeps things out, like parasites from the environment, elementals, things like this. And so when people are using psychedelics, that web kind of can open up or become more porous, or it will start to have a tear where things can enter in, right? So even if we go through and we clean up all the issues, the tears, the thinning, all that stuff. The other issue is that when, like how to say it, when you're open up to perceiving things in the environment that you don't normally see, there's good things happening, and there's, I use this term really loosely, but like you could say negative things, but it's tied to a cycle of it's tied to a cycle, just like how there's spring, summer, fall, and winter, right? Winter is a period of decay, right? Everything kind of dies off, falls away, and then spring comes again, right? So part of what is constantly going around us is, you could say, spring, summer, fall, and winter. The webs keep us from seeing the decay and the degeneration in the environment and in our surroundings that is happening, but we're just not aware of it, right? And so it's a natural process of life. And so when psychedelics are used kind of consistently, what happens is you start perceiving these aspects, and they can be a little bit upsetting, and a person can get stuck in it, if you know what I mean. Like it's like if you took a glass of water, right? You took a glass of water and you walked outside and you poured it into the earth, right? The earth would be wet, but it would be mixed with dirt. So the water is still there, but so is the dirt. It would be hard to extract the water back out of the dirt. That's what happens sometimes with the mind. It will get stuck in the negativity and gets kind of entwined and becomes hard to like pull out of it.
Yeah.
So with that, excuse me, with that, I would clean up a lot of like lower emotions and instinctive responses. Clean up the arms and legs a lot, clean up the lower centers a lot, like navel, spleen, Mingmen, sex, basic. And potentially that could help reduce that, but you know, sometimes it just is what it is.
Mhm.
When done in a like a spiritual setting, not all psychedelics are created the same. You know, some are better for ceremony and some aren't. But you know, when I used to travel with the medicine man that I used to travel with, we did not do peyote. Like he was pretty clear that is not our path. And
Is that a mushroom?
it's I think it's a type of fungus, like it grows out in the desert, or it's a type of cactus, maybe. I can't remember what it is. I've never seen it. I've heard about it, I read about it, but it's something like the mushrooms, right?
Oh, okay.
And whenever we'd get around other medicine men that were like peyote medicine men, it was always the end of the world is coming,
boy.
Armageddon, you know, it was always like these negative things. And I had this one really, really funny experience one time where we were at the Sundance, and, you know, I was the firekeeper, and when medicine men would come through, you know, because it's a big, big event and there's Sundances happening everywhere. So if a medicine man came through, he would let them lead the lodge. And I would be sitting next to him, and you know, most of these guys, it was different than what I was used to, but you know, it was fine. And this one guy came in, and boy, it was Armageddon, end of the world. You know, he was saying a lot of graphic and bizarre things. So everybody clears out, and me and the medicine man are sitting watching the fire, and you know, it's probably like 2 a.m, and we've been sitting there for an hour or two, and everybody's gone, and it's just starlight, and you know, no lights, no light pollution, it's just darkness, right? And we're staring at the fire, and you know, it's just very quiet. And I lean over to him and I go, "Hey, what was up with that medicine man that came through?" And he went, "Peyote," you know, and it explained everything. You know, I had no idea, but given all the strange things the person was saying, they made a lot of predictions that none of it came true. And like, you know, it was just a bunch of weird stuff. And so I even asked Imaho about it later, and he just says, what happens when you use psychedelics like kind of consistently like that, your like your consciousness or your mind can get trapped, right? It can get trapped. So at first it feels kind of liberating, but after a while it almost becomes like imprisoned. And so if they're going to continue, I would say turn it into like a spiritual experience of sort, other than just recreation. You know, have them do a prayer or a little ceremony or something like that. But you know, for a little bit, it's okay. But if it's going to be a long period of time, there'll start to be difficulties the more exposures they have. You know, in different substances, it's different amounts of the exposures, but the rule of thumb a lot of times is 15 to 18 exposures. Psychedelics, you might be able to get away with a little bit more, but something like LSD or something like that, which is not, you know, the same. I mean, it's a psychedelic, but it's not the same. It would even be less, you know, because that's a chemical. The chemistry is much more damaging to the nervous system, and so with so many exposures, it literally will start to change the brain chemistry a little bit, and sometimes there's no coming back from it, you know. I treated one guy one time. He was at a party and somebody handed him something that he thought was pot, like he thought it was a joint, and he started inhaling it a whole bunch, and it was PCP. And literally that one puff off of the joint caused brain damage. You know, it caused a significant change in his brain chemistry that it didn't even manifest immediately. You know, he got checked out by the doctor and everything, because I mean, it was not his scene. And the issue didn't even start manifesting for about 10 years, 10, 12 years. And then, man, he had some serious depression oriented issues. And so, you know, there's something to be said, because the thing with the mushrooms, I'm
Mhm.
assuming you're talking about psilocybin. I mean, you possibly could be talking about amanitas, but psilocybin is usually the one that they use. Um,
I
small
don't
small
know.
dosages,
Yeah.
small dosages actually do reset the fear responses in the brain. And
Oh.
so, you know, in a therapeutic setting, there is neuropsychological studies being done on how to utilize these substances for healing traditions that are very like trauma related, PTSD
Mm.
related, and can be effective, but the dosage is important. It needs to be small. You know, it needs to be, it's just like anything. If you drink 5 bottles of wine, not very good for you, but you know, a couple glasses of wine, it's fine, right? It's the same thing
Right.
with these things. If you take a small dosage, it can be okay, but a huge dosages that causes the euphoria and everything, not very good for you.
Okay. Um, are
Uh,
I'm
it does.
sorry, I'm very ignorant about this. Are mushrooms something you take take internally or you
Yeah,
smoke it?
no,
Oh,
you would eat them.
eat
Yeah,
them.
yeah,
Okay.
yeah,
Small dosage. Okay.
yeah. So when they microdose, sometimes they'll just eat a very small amount, or
Mm-hmm.
they'll make them into a tincture, and then they'll just take a few drops of the tincture. And so a lot of times when they're on that, you can't even tell. Like they could go to work and function and they would be just fine.
Oh,
And
okay.
but it's because the dosage is so small. And it's what they're doing is they're trying to reset the fear mechanisms. And
Mm-hmm.
so there was a group of psychologists that about, I'd say it's been 20, 25 years, 22 years, something like that, where they were treating vets from the Iraq war back in the 90s, you know, the
Oh yeah.
92, 93,
Mm-hmm.
whatever that was. They were treating some of the vets with PTSD with that. And it was quite effective, actually.
Huh.
There was 2 theories where they were giving a big dosage in a psychologist's office so that they could be monitored. And then they were doing micro dosages over a period of time. And, you know, I didn't know them well, but I knew the people who were doing these things. And I was just like, you got to drop the big dosages. Like
Mm.
it's too intense. It could go very badly quick.
Mm-hmm.
And so, you know, because they're having a trip, and if the trip goes bad, they're more traumatized. And so the ones that were doing the micro dosages, it was actually quite effective, you know, and there was no risk involved, or very little risk, I should say.
Mm-hmm.
Yeah, but you know,
Okay.
but still people are going to do it. You know, it's a bit of a thing these days. And so you know, ayahuasca is another one that people do. There's all kinds of things that people do now, that you know, 20 years ago they weren't doing quite as much. And so
Mm-hmm.
um just clean them up, and
Okay.
like look for like parasites, you know, elementals is what we would call parasites, and a lot in the arms and the legs.
Okay.
Yeah,
And
I used to
I
ask
just
I used to ask Master how to clean people up with that, because in shamanic circles it's very common, very, very super
oh,
super
okay.
common. And so that's why I
I
was
was
asking, is it done in ceremony or
yeah.
this or that? And so you know, that's why I say I get it. just clean up the arms and legs quite a bit from elementals and parasites, because you are opening things up, and so those filters aren't working like they should,
Right.
and so things can come in and then they have to be purified and released.
Got it. And speaking of master, I was going to ask you about Master's Blend. Is that a good one to use topically on the arms and legs?
For arms and legs, I would probably use, I mean, yeah, but for this, I'd probably use Palo Santo.
Okay, got it.
Aloes would work better, but it's also expensive. Palo Santo,
Right.
inexpensive, and they could go crazy with it, and it would be just fine.
Yes, thank you so much,
Yeah,
Greg. Appreciate it.
you know, this is the thing. I get it when people are doing those things and they're seeking something, and I think that when they're doing it, I just, you know, as a therapist, I just clean them up, and if that's their path to seeking something, you know, of course, I try to turn them on to meditation or this or that or whatever. But if that's the path they're going through, then it could be a stepping stone to something else. And I don't try to adamantly talk them out of anything, but I also don't suggest that they do it. Like, you know what I mean? I feel like I approach it as Switzerland. Like, you know, let's just go through and clean them up and you know, help them be whoever they're going to be. So
Right.
I would say, you know, you handle it however you want, but don't feel you need to have a talk with them or something like that. Just
I went very lightly. I said, maybe let's try to stay away from that just for a bit. That's all I said.
Like here's the issue that I would suggest, or like when I was doing therapy all the time, if it was somebody in their 20s or 30s or something like that, didn't matter. If it was a teenager, they needed to stay away from it for a little while. You know what I mean? Like they need to let their brain develop before they start doing stuff like that. You know, but if they're in their 20s and 30s and, you know, it is what it is.
Right. Got it. Thank you so much, Greg.
You're so welcome.
Appreciate it.
I did want to let you know peyote is a mushroom. Someone let us know.
Oh, it is a mushroom. Yeah.
And then
I actually knew a guy like this. I mean, this is like why I also don't like to judge these things. I knew a guy that was going through, he had really bad cancer and none of the treatments were working. And he was like, well, I'm giving up on, you know, whatever. He'd done the chemo and they basically said, you have a couple months to live. And he went through and did peyote ceremonies. And I think he lived like another 15 or 20 years. Like it was mind blowing. So I also like, that's why I was like, kind of don't want to be judgmental and pull somebody out of it, because he was feeling very guided to do it. And I just thought he was wanting to do it, you know, before he left his body. And it ended up healing the cancer. He went into complete remission.
Wow.
The doctors couldn't explain it. They were like, there's no reason this should be happening.
Because these are the same type of medicinal mushrooms. Is that accurate or totally different?
There's psilocybin and there's amanita, and there might even be other ones, but those are the two that I'm aware of. And so, you know, the amanitas are you know how you see the decorative like mushroom that's red with the little white spots on it.
Oh
Yeah, that's a magic mushroom. Like that's a psychedelic
mushroom.
And then that's an amanita, and then the psilocybin are these like little gray ones that I think they grow on cow dung or something like that. And so they're slightly different, but the more common one is the second one.
I see. I've only seen the red and white ones in fairy tales. So.
And those actually grew at the bottom of, or they still do, they grow at the base of spruce and fir trees. And
Oh,
so if you think about Christmas, what
yeah.
the traditional thing is packages that are red with white polka dots.
Mm-hmm.
When you're growing up, that was actually tied to the mushroom back in the day.
Interesting.
I
Wow.
don't think it had some magic mushroom. It was just like, this is what happens in the forest, and somebody was recreating that. But what they were recreating was that mushroom.
Interesting.
Yeah.
I love your stories.
Yeah.
Thank you
I
so
actually
much.
used to know, like this is how weird my circles are sometimes. It was in a Buddhist, in some of the Buddhist circles. He was like one of the top guys in the country on mushrooms. And I just thought it was like, like Rishi and Mataki. And then he started talking and I was like, oh, it's peyote and Amanita. Like he was,
Mhm.
but he was like a Buddhist meditator guy that his thing was meditating with mushrooms. Yeah.
Mm.
Recording in progress.
Yeah.
Thank you, Greg.
So
Great. I'm echoing.
And then
that's just to exaggerate the psychedelic conversation that we're having is
go ahead, Jennifer, then Letty, then
Hey,
Sean
Jennifer.
Amanda.
Yeah,
Hi, Greg. It's nice to see you.
good to see you.
So last time I had a question, it was about helichrysum and bay laurel for my family.
Okay.
And one of the reasons was I was asking is because, which I love those two products. My oldest son has spina bifida, and
Ooh, okay.
it's a very large myelomeningocele. He's walks with arm crutches. He's 21 now, so he's totally independent, off on his own. He's actually at university and on a para-track team, so he's doing
Wow.
remarkably well. So he's had some, a lot of miracles in his life, but his latest thing that we're trying to figure out is he has this, and I have a sneaking suspicion it has to do when he was a little baby, and he had a lot of tubes going down his throat from the NICU. He has this snoring going on, and it's so much so that I believe it's getting in the way of his health. He doesn't know what it's like to be without it right now. And
Mhm.
so but it's something where it's getting in the way where people won't even sleep in the same room with him. It's so bad.
It's getting so super bad.
And I'm just trying to right now I had him on some ANS support,
Mhm.
and then diffusing sinus health. Whether or not he's doing all of this on a regular basis, I don't know, actually, for sure. But I'm trying to see, is he on probably the best things for him? He does work out quite regularly.
Wow, good for him. Good
He
for him.
he's a big kid who's very incredibly muscular. I know he's got some tightness going on in his diaphragm and like the
Yeah.
intercostals.
Yeah.
But from a standpoint, like if I can provide him with anything that
Yeah.
might be
So
helpful.
I would say there would be a couple things that I would try right off the bat. So one would be, I mean, I think you nailed it with tight diaphragm and tight intercostals. Inhaling either like hyssop or larch. There's fancier oils. I don't know that they would work any better, but those would probably be the two that I would start with, you know, one or the other. Like it doesn't need to be both of them. And like you know, every night as he goes to bed, like 15, 20 just long, slow, deep breaths.
Mm-hmm.
If he would rub some things on his chest and things like that, you could use where's the spine? Let me just think this out for a second.
Mm-hmm.
I would actually rub marjoram on the like in a massage oil or lotion, and then rub it on the rib cage, you know,
Okay.
as much as he could. Like do that first, and then do the hyssop. The other thing that is kind of an interesting little, it doesn't fix anything, but it does reduce a little bit of the snoring, is right as he's going to bed. You know, he can go through and do all that, but take half a teaspoonful of olive oil,
Mm-hmm.
you know, just like, and then down. Don't drink anything after that. And it kind of coats the throat,
Mm-hmm.
and it would help to reduce the snoring.
Okay.
You know, that's more for the people around him, not so much. I mean, it's going to help him a little bit, but it's probably
Mhm.
more for the people around him than anything.
Sure.
Therapeutically, though, the hyssop and the marjoram on the chest.
Okay. Do you think he should stick with the ANS support and the
That would still be super good. I mean, it
Okay.
relaxes the smooth muscle, both of the gut and the respiratory tract. I mean, it would be helpful.
Okay.
Let's see how this treats him, and then after that we can do an adjustment. But
Okay.
you know, especially when, like you were saying, like you're not sure how much he's going to do it, let's not throw a lot of things at him. Let's throw something at him that, let's see if it works, and then if it doesn't, we can make adjustments rather than giving him 5 things to do.
Right. Okay. So he's been putting the some like the helichrysum, the bay laurel, and the ANS support like in his water.
Yeah, sure.
Um,
Good for him.
so do you think just a better thing would just to have him do like the margarine and the hyssop, like you said, and then just encourage him to put the ANS support in his water, just to continue and just do those
Yeah,
3
you could
things.
continue with the ANS in the water. I like that he's taking the helichrysum too.
Yeah.
But the hyssop, don't take an internal, just inhaling. And the marjoram, I mean, it has an antispasmodic component to it.
Mm-hmm.
A couple of drops internally would be okay, but I think here topically would be better. But he's more than welcome to experiment with that component of it. But the hyssop, definitely don't take internal.
Okay. All right. Okay. So the margarine, it's interesting because the margarine has helped my 2 other kids too. They both have had jaw issues, and
Yeah.
they go to the chiropractor, and one of them sees a massage therapist as well. And so we'll always put it on before the chiropractor or the masseuse, and then I just ask them to just focus their intentions when they're working on them on their jaws straightening out and their teeth straightening out. And I've noticed a significant difference.
Oh, good.
So just a little fun thing that's been happening with my family with all your oils.
Oh, tremendous.
So,
I
yeah.
mean, especially for massage and chiropractic, I mean, putting marjoram on the spine or even close in the area will usually help the adjustment go deeper.
Yep.
There's a chiropractor that we know back east that basically is made up like a spray bottle with marjoram and just alcohol, and before he does an adjustment, he lifts up their shirt and sprays down their back, lets it dry, and then gives them
Yeah.
the cracking. And he said adjustments go way easier with that.
Yeah, that's what so every before they go for either their adjustments or the massages, we always just coat their spine and
Mhm.
then put intention on the base of their neck too.
Oh, nice. Yeah, yeah,
And
yeah.
it's been helping
Good.
significantly. So,
Yeah.
yeah. Okay, well, I will let them know. Thank you for all your help. I
Yeah,
appreciate it.
yeah. Keep us posted. I'd be curious to see how that plays
Yeah,
out with
me
your
me
spine.
too, because
Yeah, yeah.
can't stand sleeping
Yeah.
near him. All right, take care.
You bet.
And go ahead, Letty, then Shada and Amanda, and then Deborah.
Hey, Letty.
Hi guys, how are y'all doing?
Good, good, good. How about you?
Doing good, thank you. Greg, so I have a quick question.
Mhm.
I have a coworker whose mom has like a chronic cough. But
Has a
before I
what?
gave any, sorry,
It has what?
a chronic cough.
Oh, cough. Gotcha.
Yeah, and this, I know like I have your Effort Healing book, which I love, but before I gave any oils, I just wanted to see like if you could see maybe what's causing that, because she doesn't really have any health issues or known health issues. And they've done like a lot of like studies or like, gone in and checked her out. And apparently they tell her like they don't know what she has. But and it's not asthma, according to them, but she does have a nebulizer and a inhaler for when it gets really bad. But I don't know, I just think it's kind of strange.
So is it more of a throat cough or a chest cough? Is it
Ooh.
more like, or is it, you know what I mean? Like, is it
Yeah.
feel like she's trying to do something with the lungs, or is it just like it sounds like it's coming from the throat?
Honestly, I didn't think to ask that, so I would have to ask.
Is the person a smoker?
No, she's not a smoker.
Did she have a history of smoking?
I'm not sure on that. I would have to ask.
Okay.
Sorry.
That because there's different kinds of coughs and there's different like causes of the coughs, and so let's just explore a few things so we don't, you don't have to like wait and come back. Like I'll just explain a few of them, and I think it's probably what we would call a spasmodic cough, but let's look at it as if there was a history of smoking, right?
Okay.
And so it could be 10, 15 years after the fact, where they could still have developed like what you would call a smoker's cough, right? And so oils can be helpful. Probably with something like that, I'd use like maybe dark blue tansy inhaled, even a couple drops internally, or a couple drops of frankincense internal on a daily basis. Like it needs to be daily. But if it's a smoker's cough, even if the smoking had stopped 15 years ago, like later in life, they can still develop what you would call a smoker's cough. There's an herb that's out of the rainforest called Pau d'Arco. Pau d'Arco is incredibly good for smoker's cough, like really, really, really super good. Like I don't really see anything else that treats a smoker's cough the way Pau d'Arco does. The other issue with if there was a big history of smoking is I would put them on quercetin, just because the tissue is usually vitamin C deficient because of all the smoking. And even though years has gone by, there's still like a destabilizing of the collagen and things in the tissue. And so the quercetin helps to stabilize the collagen and deal with the vitamin C issue. Weird little side note: do they have eye issues? Are they having like difficulty with seeing or cataracts or anything like that?
I don't think so, because she says that her mom brags about how healthy she is, other than she's got this chronic cough.
Chronic cough. Okay, so So it could be like we were just talking about prior, where it's a tight diaphragm, tight intercostals. And it also can cause tightness in the neck, specifically the sternocleidomastoid. And so doing the pursed lip breathing, where you inhale and then purse your lips and then force the air out, really tight lips, where you go. You're relaxing the diaphragm, you're relaxing the bronchioles, and using hyssop to inhale will deepen the relaxation process. That's usually what I would do. And in the case of a chronic, what we would call a spasmodic cough, one of the things that I also use is 1 to 2 capsules a day of Lobelia, right? Lobelia, and not in tincture form, in a capsule form. And Lobelia it relaxes the tissue, it relaxes the fascia, it just starts to relax things. Once the Lobelia wears off, sometimes the fascia kind of snaps back, but done over a period of time, you're re-educating the body, the nerves and everything. And so eventually it will stick, but it's not going to be just like a dosage or two that's going to do it. You'll have to, do it over a period of time. The hyssop can unwind it. And so the Lobelia would be a way to augment that. But it could come from, previous cold or flu where they were coughing a lot. It could be the way they sleep. Like if they wrench their neck a lot while they're sleeping, like if they lay on their stomach and then really wrench their neck to the side, that could cause it. And neck injury or whiplash injury could do it. Body misalignments could cause it. And so, we don't think of things like that causing coughs, because we think of them as being just primarily a respiratory issue. But anytime that the sternocleidomastoid gets severely contracted, it throws the breath off. One of the things that we look at is there pain around the eyes? Is there pain in the ear? Things like that. It still could be the sternocleidomastoid, even though there's no pain present, but usually a spasmodic cough doesn't respond to the issues of like a nebulizer, an inhaler, or anything like that, because that's targeting the respiratory tract and not the muscles in the neck. The other thing I'd look for is if there was dizziness, vertigo, consistent on and off ringing in the ears, like things like that. All of those would be indicators that it's probably a sternocleidomastoid issue. The other potential issue that it could be, do we know, do they have a thyroid issue at all?
I know for sure now. She just replied, no history of smoking. So
Okay.
that's out.
Okay.
Thyroid issue. I mean, I don't think so, because I had asked if she took any medications or anything. She said
Okay.
no, other than vitamins, and
Okay.
just maybe something for acid reflux.
Oh, the acid reflux could actually be doing it.
That's what I was thinking.
Yeah, the acid reflux could actually be causing it. It could be causing, because there's actually like a stomach cough that comes from the actual stomach, not the abdominal cavity, but the actual stomach. ANS support might help. Basil clove might help that. I tend to use basil for that, some form of basil. They have to ingest it though. Like topical won't cut it, inhaling won't cut it. They would have to do it kind of consistently over a period of time, just like a couple drops in water a day. The other potential issue when you see, so they don't think she has asthma, but they're kind of treating it like asthma. Is that what's happening?
yes, they give her the nebulizer and inhaler for when she does have like cough attacks. Apparently like the cough is there all the time, but then there's times where it gets like really bad. I
Okay.
mean, and it has not been diagnosed as asthma.
So so there's two more things that I'd like to address. So one is it actually could be her vocal cords. And the vocal cords, that's why vocal cord issues can be with a thyroid issue, and it could also be with reflux. And so that she's having some potential reflux there. It's possible that's what it is. You know, you need to calm down the reflux, but what happens is the little muscles that affect the voice box, you know, your vocal cords, they can go into a spasm just like anything else. It presents like asthma, but when you get evaluated, it doesn't look like you have asthma, but you have some of the symptoms, right? And so the things that work for that is I usually use Roman chamomile. Like I have them gargle with it and take a couple of drops internally daily, even a couple of times a day at first. And that usually will resolve it, unless it's, you know, there's these things where there's paradoxical vocal cord syndrome that usually happens when there's been like a surgery on the thyroid or something. But just tension in the voice box and the vocal cords, it can happen for a couple different reasons, right? And so I would explore that, especially if they think it's asthma, they're using asthma medications, but it's not really helping. And when they evaluate, they go, well, you don't have asthma, but you have some of the symptoms. A lot of times that's the vocal cords. Like it is consistently been the case where it's a vocal cord issue. And so, you know, because it throws it off, but when they go through and they evaluate the lungs and the bronchioles and everything, everything's fine. And so, and then they don't respond to the nebulizer. So there's that issue. And then if we set all those kinds of things aside, slipping into the energetic realm, cords. And she's got some big cords to front back solar plexus, and she's got some to her throat and her back throat.
Okay.
Yeah, she
I
got
will
some
go
really
ahead and cut
big.
those.
She got some really big ones to the front and back solar plexus.
Okay, yeah, and I could tell that it was solar plexus was protruding out really big. So she did
Did you have
suffer a lot
people
of.
that like adversarial with her or anything like that, or what kind of work does she do?
She's retired, but she worked in the prison system.
Oh, it's cords. Forget everything that I said. It's cords. So yeah, like if that's the case, yeah, it's going to be a lot of cleanup. It's a lot of people. Like, what did she do?
She worked in the prison system. I don't know exactly what she did in there, but I know that that's kind of where she retired from.
Yeah. It's cords. It's not even just cords. It's just in those kinds of situations, you know, it could be, you know, we think of it just as like guards, but it could be like parole officers, you know, somebody doing like the paperwork. You have a lot of people grinding on you all the time, and, you know, desperate to get out, desperate this, or upset that they're not getting out, or, and it's just like kind of been a constant form of psychic attack, you know. It's not like they're sitting there and wanting to hurt her. It's just they're being willful or upset or angry at her. Even if it wasn't interaction, it's just always being directed at her. So, you know, describe it to her however you want, but just some serious cleanup needs to happen. And are you going to work with her with oils, or are you going to do other things?
I think she's willing to do energy work as well. I think she's at a point where she's like, you know, when people get to that point where they're desperate, they're like
Yeah.
willing to try anything.
Yeah. Okay. Because like even right now, like you could cut her cords, but it's you probably need to do like a half a dozen sessions of just cleaning up her aura. Like, I mean, that's like how bad like it can be. Before you even really cut the cords. And so you know you have the notes for the Samba Fun class, right?
Yes, I do.
I'm kind of joking about that, like because you're the one that puts them together. Right? So
Yes.
you don't even have to follow a pattern, but follow the sequence, like
Glory of Lebanon, right?
Yeah, and just do that, and then
Okay.
just have her inhale, and then just 5-10 times, move to the next one, 5-10 times, move to the next one, 5-10 times, move to the next one, because you are literally unwinding the different layers of the energy body, and something happens in each one of those layers. And so that has to be done consistently for a while. Like her energy field is so impacted that
She was also physically abused by her husband.
yeah. Give me
Sorry,
just a
her
sec.
ex-husband. Her ex-husband.
Give me just a sec here. Have her use those 7 oils every day for like, just inhale them 5-10 times each one, move to the next one. And then after about 30 days, we can go through and do some of the other stuff. But her energy field is so impacted that it's like, I don't know how to like it's almost like there's no differentiation between the different energy centers and everything. Like like it's almost like it's like corporatized, like it's just like dense. And so for a little bit, you just got to unwind. Okay, let's say it like this. You have a bowl of water and it has a goldfish in it, right? And the water in the goldfish bowl is really dirty. And you pull the goldfish out, you clean it all up, and then you drop it back in the water, right? It's like still in dirty water, still in dirty water, still in dirty water. And so actually what even happens when you start going deep into the body and releasing things, it's like it releases a little bit, but then it allows more of that compacted energy to go deeper into her system. Does that make sense? And so
Yes.
you almost do the opposite, like doing the 7 oils in a row helps to unwind the things that have been projected at her for a period of time. But like instead of doing healing directed at her and her body, it's almost like you stand in front of her and face outward and you sweep outward, like not towards her, like you're standing in front of her and sweeping away from her. But what you're doing is you're cleaning up the different energies that are just lingering in her energy body. So you can have her do that. And would she chant Om Om might help. It's not going to help massively, but it's something. Have her chant Rama, actually, if she'd be open to it. Just not even Om, just Rama, 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 Rama.
Okay.
If she'll do it. I mean, that could be weird for somebody, but if she's open to it, and if not, no big deal. Just trying to give her tools to address that. I mean, it's not going to be like an over the top fix. It's literally like chipping away something for a period of time. You know, like I used to know what one of my clients was a what did he do? I want to say he was a parole officer. Yeah, parole officer. And you know, I saw him once a week, and you know, doing energy work, and it was like 6 months of just doing general sweeping before I could start working on the chakras. Like 6 months. That's how bad it was. And he, you know, he was retired. It wasn't like it was an active situation, but he had just had, you know, decades of people just grinding on him. And you know, that stuff lingers in the field. Like it really lingers there. And so you just got to systematically unwind that. You know, if you're going to do healing, do that. And, you know, I'm happy to guide you through that, but it's going to take some work for a little while. But that's what the cough is.
Okay. Thank you
Yeah.
so much.
Yeah. It will manifest as physical issues and physical symptoms, but like here you are talking about how the doctors don't really see a reason why they have it. They give her medications, but there's really no like physical reason. It's like even when she unwinds some of the symptoms, the energy keeps compressing back in on her. You know, that's the whole thing with that 7 layers that we're going to be doing next weekend is, you know, we're going to be doing different patterns and everything, but basically unwinding the different layers so that the energy body can handle more spiritual energy, more light, more emotional, mental energy, but it unwinds and breaks the patterns that are lingering in your energy body that have been there for a very long time. Some of them are from our family, some of them are from situations or work, whatever it might be. And if so, for this person, boy, it's our work. She got really big cords to her solar plexus, by the way.
Okay, but you don't want me to touch that at all yet.
I would unwind her energy body for a little while, at least 4 or 5 times before you even start cutting cords. And even when you cut cords, it's not even going to be that you're cutting them. Like you're going to diminish them for a little bit. So you're going to have to like cut and clean them, like actually clean the cords, and then cut them some more, and then clean them some more, because it's like there are a bunch of little cords that just turned into one big giant cord. Like it just looks like redwood trees growing out of her front and back solar plexus. And it's probably just a bunch of little ones that all made a real big one.
Wow. Okay.
Yeah. Like,
Thank you.
you know, I've told that story where, you know, it wasn't even in law enforcement. It was a CEO of somebody, you know, a company that, you know, he had about 8,000 employees under him. And the cords would get so bad, I'd get these calls where he'd just go, "Hey, can you go through and clean me up? I'm starting to have bad luck again." Like his blood pressure would get all erratic. He'd get sick, you know, like bad things would start happening. He'd start having little accidents, like, you know, he'd, you know, bump his head, and then he'd trip, and then he'd slam his finger in the door. And then, you know, it was just all these little things would keep happening, and we'd go through and we'd clean it all up, and he'd be fine again. And somebody in the prison system, it's like that on steroids.
Wow. Yeah.
Yeah, it's significantly worse because, he was dealing with the employees.
Here
That-
you're dealing with criminals.
Yeah, you're dealing with inmates and inmates who want out, who think they're there unfairly, who are angry or, whatever it is. And then you have the family of people and it's just a lot. It might not have even been specifically at her. It could have been just at the system, but she was part of the system.
Okay. Thank you, Greg. Thank you
Yeah.
so much.
You're still welcome.
And then go ahead, Shraddha, Nananda, then Deborah, then Denise.
Hey.
Hi, Greg. I kind of have a little bit of a laundry list here.
Yeah, fire away.
Um,
I'm good at laundry.
Good.
Not really, but this kind of laundry I am. Other laundry, I just throw everything in the washer.
Yeah.
Doesn't
I'm
matter. I
starting to
don't
feel like that's
separate
what I need to do. You're the washer. So, where do I start? After the immunology weekend.
Yeah.
Thank God for that, because for the first time in 2.5 years, I caught COVID.
Oh, wow. Okay.
First airplane ride, and that was the end of that. So
Right.
the first week I was pretty good, just felt like I had a really bad flu, I had energy, and then everything went haywire, and I think it attacked my nerves and my muscles,
Okay.
because I spent the next 2 weeks with wobbly legs. Some days, if they weren't wobbly, I just couldn't stand for more than 3 or 4 minutes, but it was all legs. It wasn't fatigue or anything. I just,
Were you breaking into a sweat?
no, but I'm not sure that's an indicator of anything because I don't really sweat much.
Okay.
I mean,
Didn't get clammy or anything like that.
no,
Okay.
no, wobbly legs. I have a couple of friends with MS, and I was kind of walking like them, just the floppy feet and legs. And it wasn't constant, but when it happened, it would last for few hours.
Okay.
Okay, so so symptoms started May 4th, and it took until the 22nd that I could literally stand. Like, I was amazed one day, all of a sudden I was just standing, and I walked about 40 yards and then I couldn't walk any farther. And I've just gotten stronger every day. But I still have, so I'm sorry. So what happens is, even through the COVID, I'd be great for like a day or two, feel like I have full-blown energy, and then I call it a relapse. All of a sudden I have no energy. So on the 22nd, all of a sudden, I was walking, I was feeling stronger, feeling like 80 to 90% normal energy. And then that only lasted like 4 days, and I've had absolute fatigue ever since. And I know they say, post-viral fatigue and stuff like that. But that's just one thing I wanted to check on. And then the other thing that's happening is, and I think COVID's just exacerbated it, because I've had this for over a year. So I have this tightness across my sternum, as though there's like a seized muscle from one side of the top of my ribs to the other, but it's all sternum. And sometimes it eases off, but it's almost always there to some degree. And so
So it goes across like this?
yes.
Does it ever feel like pressure right here?
Yes, it feels like there's a small something sitting on my chest.
Standing on your breastbone, kind of.
Yes. And then
Okay.
when I lie down, I start coughing. I don't cough all day, even with COVID.
And
I
that was
cough.
happening for about a year?
Yeah, I mean, that's just as far as I remember. The other problem with COVID, I feel like I've got some amnesia going on. just don't even ask me what I did yesterday. It doesn't stick right now.
Yeah.
Feels like there's somebody's flipped a switch and my brain's just not my own. I'm having some aphasia.
Okay.
Like my favorite color since I was a little kid was purple. The other day, I asked my husband to give me a coffee cup. He said, "Which one do you want?" And it literally took me 25 minutes to come up with the word purple.
Okay.
So, but this sternum thing, so I lie down, I start coughing. Within 10 minutes, I'm coughing. And then the only thing that eases it is all of a sudden, I feel like probably my sacrum and my sternum start going more into alignment and I start burping like crazy, uncontrollably. I just burp and burp and burp. And then it just eases off. And the next thing I know, I'm not coughing anymore.
Okay.
And when I wake up in the morning, here's the way that I wake up. I mean, you would think somebody's like got my nose and my mouth covered. I wake up and I go, and then I cough for like 5 minutes.
Okay. Okay.
So,
Okay, I have a few little questions that I want to ask before we move forward. So
ask away.
first off, are you dropping things, bumping into things?
Oh yeah, I
moving
forgot
around?
that part.
Yeah. Okay.
Yeah, my right hand, I've been for ever since COVID. Well, that happened the second week when the wobbly legs start. My right
Mhm.
arm would get stuck in the air. Like I'd go to reach for something and I couldn't continue the reach or the grasp. I've broken 3 glasses in the last 2 weeks. I think I've got them firmly in my hand and my right hand grip just opens. It's only right though, not the left
Do you have
one.
any weird skin issues down on your hands?
No, but I did get 2 styes on my eyes in the last week.
Okay, and you see how my hand is?
Yeah.
Okay. And if I bend my fingers, like my fingers go back and I try to touch, not like down like this, but like to the top of the pad. Can you do that?
No.
Okay. And then,
Gosh, I didn't even know I couldn't do that.
yeah, well, I mean, how many times are you going to go around and go, look what I can do?
Yeah.
You know, it's actually, it's a test, like, you know, you're looking for something. And then, okay, so one more thing. Let's just test this to see, but so what I'd like you to do is take a long, slow, deep breath in through your nose and then hold it. And then as you exhale, try to exhale evenly, but longer than you inhaled. Like, so if it takes you 15 seconds to inhale, exhale taking 20 seconds. And
Okay.
just see if you can do that, or if it's like really erratic, or, you know, one of the things that happens is you inhale and then you go, okay, now I'm going to inhale slowly. And then you go, and then it's just done. Like,
Okay.
so see what happens when you inhale and then pause and then exhale.
So there's a choppy break
Yeah. Okay.
beginning,
Yeah.
and then
That
I
help-
can exhale completely, but then my sternum locks again and I can't
Yeah.
exhale anymore.
Yeah. Okay. That's so. Your two problems are actually facets of the same issue, and
Okay.
and so when so your breath is off, and you actually have what you would call paradoxical breathing. And so what happened is, it could have been from, because it sounds like it happened like about a year ago, but could be because of the COVID, could be combination, could have been happening slowly over a period of time, could be that it was because of a cold, a flu, respiratory issue, excessive exercise, a neck injury, you know, there's all kinds of reasons. But basically this test right here, you're testing there's these really super deep muscles in your neck that stabilize your head and keep it like upward. It's like it's these little finger muscles that kind of go from your vertebrae down to like the ribs and things, and it keeps your head from just flopping to the side. It helps you keep your head up. And the reason why you can't do this is they contract, but you have a bundle of nerves that passes through here called the brachial plexus. And so when they tighten up, it actually compresses that bundle of nerves and doesn't allow you to do that. Like it, you know, you do this, or, you know, sometimes it's just maybe one finger, but it's because the nerves are being compressed by muscles in your neck. And so what this does is it actually flips your breath. And so that's why it's called paradoxical. Like, so when you inhale, naturally, your, like without thinking about it, your abdomen would expand. And as you exhale, your abdomen would compress a little bit. You know, you're not over exaggerating it, you're just doing it. With paradoxical, it actually flips. So when you inhale, it's like the stomach goes in and you're having to manually do it with your chest.
That's
And
how it
then-
feels.
Yeah, it's exactly. And so it causes the chest pain. I mean, anytime you have like that line across or pressure on the breastbone, that is a respiratory issue. And it's one of the indicators like, okay, that could be potential paradoxical breathing, but then that always is an indicator. And then it throws off your inner ear, and, you know, starts to give you a little bit of can give you a little bit of vertigo, could like loss of balance a little bit, you know, just makes you feel a little bit like off, like it's hard
I
for
had
you.
all that checked last year. I went to an ear specialist. They couldn't find a
Yeah,
thing.
it's because it's muscular. Like
Okay.
it's not the ear, it's actually the scalenes, which is the muscles that we're talking about, and the sternocleidomastoid. When they have trigger points, it actually will throw off the inner ear. The inner ear will look fine, but it actually is throwing off the equilibrium. And so because of that, it actually starts to affect the nervous system. That's why the brain's not registering quite like it would. And you're starting to have like neurological symptoms, because the breath is tied to movement of nerve activity both to and from the spinal cord. And so when it becomes paradoxical, it actually starts to affect that flow of back and forth and back and forth. And so what starts to happen is, it's not like you get neurological diseases, but it's the nerves are becoming affected, and the nerves don't quite function like they should. And
Yep.
so like your description of like you were doing something and then your arm is not doing like it should, or like you're losing your grip and things like that, those are all signs of the efferent and efferent movement of nerve flow is being hampered. And so yeah, the the way to go through and treat it, I'm just looking at you a little bit longer. Give me just a sec here. Are your hands going to sleep at all?
Yes.
Yeah.
My hands and feet are chronically cold.
Okay. Do you see a chiropractor?
No.
Okay, we'll start by treating it like this. So normally, you know, the more you kind of deepen the breath and things like that, the more you can unwind it. But did you ever have like a neck injury or whiplash or anything like that? Even if it was years and years ago? Fall
So
and hit your head, you know, any sort of thing like that.
so almost 40 years ago, I did not, that I know of, I did not hit my head and they didn't treat it, but and I had a sledding accident and I basically
Yeah, that would do it.
bent myself backwards.
Yeah.
My feet touched the back of my head, witnesses said.
Yeah, that would do it. Okay. Yeah, you know, not that that changes treatment, but like I'm just trying to figure out, like, is it a body misalignment? Is it the way you're sleeping? Because it's chronic and it looks like your first rib's out of place. And so,
Yeah. So they so I was, I guess, you know, all my life until the accident, my right leg was greater than an inch shorter than my left. And so then when I had the accident, it knocked out my compensated alignment to the point that if I stepped on a pebble, it would throw me off and I
Okay.
couldn't walk for months at
Yeah.
a time.
so
Yeah,
yeah,
so I had
that
alignment
all makes sense
for a long
Yeah,
time.
making sense of what I'm seeing. So like, okay, like I feel good, like, because I don't want to like start doing something and have there be some other unrelated issue or something we haven't looked at, you
Yeah.
know, also contributing to it. But all of this makes sense.
But can I
So-
tell you also,
Mhm.
I had a energetic release just on Thursday with probably, I stopped counting, but a minimum of five past life memories of being chained and bound um because of the aphasias and mental you know, my mind changing, I guess, due to illnesses and injuries and things like that. And when that release finished, I was just one big pool of phlegm. I mean, the congestion that came out was incredible.
Mhm.
So I just, you know, I guess it doesn't really matter. I don't know, I don't know what's past and what's present, but this body is thoroughly affected.
So here's the thing is normally we would go through and treat this a little bit like a bit of a respiratory issue, but
Yeah.
with it being so ingrained into the fascia of the body,
Yes.
we need to treat your fascia before we treat the respiratory tract, because your body is really locked into a pattern. And so the injury from the sledding makes tons of sense. Like it, at least one of your first ribs is out of place. It might even be both of them. It just means they just like kind of pop up, you know.
Yep. That's how they
And
come.
so so for a little while, what I'd like you to do is use either Pepper Supreme or Viscosity.
Okay.
Okay, so both will be good for releasing fascia. You know, it stimulates lymphatic movement, things like this, but different misalignments do different things to the body. And when the scalenes are involved, it does start to affect the nervous system. And then, like you said, the brain function starts to feel a little off, like you're having difficulty like recalling things. Part of that is the alignment that's happened in the body. And even though like when you're standing, it might be one way, but when you lay down, it might go back to like an old pattern.
Yeah.
And so it's because it's like locked in the fascia. And so what we're going to do is we're going to just spend some time unwinding the fascia so that we can unwind some of this pattern so that what we do then sticks, right?
Okay.
And so you'll probably start finding relief with just even unwinding the fascia. And so sometimes the body will start to self-correct even with just that. But you can inhale either one, whichever one you choose. You can inhale it, 20, 25 times each time you do it, and you can do it multiple times in a day, right?
Okay.
Multiple times. I would suggest probably taking some salt baths with it, 15, 20 drops, let it soak in. And I'd even put a little bit on neat on like the shoulders and like the neck, but like close to where the neck and the shoulder kind of come together, and
Okay.
a little bit on the base of the skull and like your upper back. Like have your husband just put a little bit on like the area
Okay.
like between your shoulder blades, and as it's starting to turn into the neck, just like kind of work that area. You could even do a little bit on the chest if you wanted, especially up high and on the breastbone itself.
Okay.
We're just wanting to unwind that quite a bit. And do your shins hurt? Like, do they ache?
Not consistently.
But on and off they do ache?
Oh yeah, just to the touch.
Okay.
Yeah.
So eventually we'll probably go down into the hamstrings and the shins, like
Okay.
the anterior tibialis, which is that big muscle that runs right along your bone in your lower leg.
Yeah.
But at first, let's just focus on the upper part. Let's just
Okay.
get that kind of rolling. And then from there, I mean, you can start kind of doing this alongside that, but this piece with the Pepper Supreme, or any pepper will work, but I would the Pepper Supreme is like all the peppers.
Okay.
And Viscosity has got other things in it. It's a bit more expensive. I'd actually go for the Pepper Supreme just because you're going to be putting it on a bunch of places.
Okay.
Go crazy with it. You know what I mean? So get the cheaper version and use it like just even neat. It doesn't even have to be in a carrier.
Okay.
So do that. And then the blend bronchioles. The blend bronchioles.
Uh-huh.
You'll start doing long, slow, deep breath. But as you do a deep breath, you'll hold your breath like you go. And then hold your breath for about 3-4 seconds, and then slowly just.
Okay.
And then, each time, like, and then like hold your breath for 3 or 4 seconds. And then after doing that for about a week, you'll keep doing all the same things, but you'll do the inhalation, you'll hold your breath, and then instead of exhaling, you'll inhale a little bit more.
Okay.
And then, so you're like manually opening up your thoracic cage, your rib cage. You're
Uh-huh.
opening up your thoracic area. You're manually just going through and doing that. And as you do that, you're actually re-educating the scalenes in your neck.
Okay.
And so after you've done that for a period of time, we'll have somebody cut this, like edit this, and then let's get this to her so that she can watch that. So we'll send you a link to this little portion so you can just watch this without having to watch the whole thing again. Okay.
Okay.
So so after you do the inhalation and then hold and then deeper inhalation, like wait till that gets kind of comfortable, and then you're gonna do the same thing where you inhale, hold, and then when you feel like it's like time to let it out a little bit, you inhale a little bit more, and then you'll hold, and then there you'll just gently start twisting your body, because what you're doing is you're manually relaxing your diaphragm. Like you're needing to really manually open that up. And you can even start going a little bit backwards, a little bit forwards, but backwards is the more important one, like just a little bit more backwards. And so don't push it, don't force it, because here's the thing, like this is why I don't give this advice a lot. This is a little bit of an extreme situation, so I just want to talk this out for a moment. If we're in a situation where the body's a little bit compromised and things are super tight, and you know you start trying to do things where you're starting to stretch it, you know, the tendency is to go like, okay, I'm gonna force this, I'm gonna make my body do this, and what happens is you engage like the stretch reflex, and the body will start to like kind of like twitch, like as you're stretching it, and you're actually exaggerating the problem. So it needs to be like really super passive, like really super passive.
Okay.
And so you inhale, and then as soon as you start to feel uncomfortable, just go back and let it out. Don't like force it past the point. You want it to be a very soft and gentle unwinding, you know, because part of it is you're unwinding a trauma, like you're unwinding a trauma from like 40 years ago, but it's still locked in the fascial system of your body. And so you know, even though you get a massage or you get an adjustment, or you know you do a little yoga or something, there's still a pattern there that has to be kind of like unwound a little bit.
Yeah,
And so
all
by
those
going-
things never last.
What's that?
All those things you just said, they never last.
Yeah, it's, I mean, part of it is the fascia has to release. And
Okay.
so it's like you relax the muscles, but the fascia is wrapped around the muscle. So if the pattern's locked in the fascia, you relax the muscles and then you go, oh, I feel so much better. And then the fascia goes, yeah, but this is what we do. Like,
Yeah,
we're going to
yeah,
go back into this pattern.
Yeah.
And then you relax all the muscles again and you go, oh, everything's feeling really super good again. And then the fascia goes, yeah, but this is our pattern. Like, you know,
Yeah.
it just locks it into place. And fascia is like one big piece of like tissue that is compressed into our body and is from like head to toe.
Yeah.
And so it's not like it's separate pieces interacting with each other. It's like you took a big giant napkin and compressed it and made it into the shape of you. And wherever those little tensions are, that's the pattern. And then there's muscles within it. It's holding organs in place. It's doing all these things, but the pattern, if it's locked in the fascia, it's locked in the fascia.
Yeah.
And so by going through and doing the Pepper Supreme and the fascial work, you might benefit actually from the lobelia a little bit too. It's not going to fix it, but it will help relax the fascia over a period of time. You know,
Okay.
it's just 1 or 2 capsules a day, but consistently.
Okay.
Do this for a little while and just be really gentle. Eventually, when you start stretching out, you know, you're holding your breath and you're starting to stretch back and all that, be very gentle about it, because we don't want to have a counterproduction. You know, we did this study like back in my early days of it was with cyclists and triathletes, and it was males. And you know, the male mentality is, especially athletes, if a little is good, more is better, right?
Right.
And we noticed that that athletes, the triathletes and the cyclists that stretched on a regular basis,
Mhm.
we're having more injuries. And we're
Mm.
like, you're stretching so you don't have injuries. And me and a couple physical therapists, we were baffled by this. We were like, that seems so counterintuitive. And so one day we were having interactions with some of them, and I was like, show me how you stretch.
Hmm.
And they showed me how they stretched. And I was like, that's what it is. They're stretching like, ugh, you know, they're gonna push through it and make that muscle relax even more so. And what was happening is they'd engage that stretch response, and they would actually cause muscles to go into a spasm rather than relaxing them. You know, it's actually a form of like strengthening rather
Yeah.
than stretching.
Yeah.
And so just be really careful not to cross over into that realm. I always say err on the side of doing less than too much. Like
Okay.
if you're not sure, back off. Just like
Okay.
back off. Yeah.
Okay.
But start with these and let's see how your body responds to this. And if this doesn't work, where are you located, by the way?
I'm in Maryland.
Maryland. Okay. If this doesn't work, there's another approach we could try. And if not, I'm going to find you, we'll find a way to find you a therapist that might be able to address this issue for you.
Okay.
And so I don't know anybody in Maryland, but I can try to reach out for somebody. But it would take somebody who knows what they're doing. But it's very treatable. It needs somebody who knows what they're doing.
And you're thinking like 3 to 4 weeks,
Oh, probably 3 or 4 months.
3 to 4 months. Okay, that's
Yeah.
fine. I just
Yeah,
needed a
yeah.
timeline.
Yeah,
Okay.
yeah.
Thank you so
Yeah.
much.
You're so welcome. Yeah. It's a difficult situation, and a lot of times, you know, because it's not a medical condition, it's a functional problem. You know, it's usually a trauma related thing.
Yeah.
It usually gets seen in, like, the different parts are seen in pieces, and it doesn't really usually get diagnosed. And
Yeah.
so it usually the only time I've ever seen people diagnose it, besides like weird guys like me, is osteopaths. Sometimes an
Okay.
osteopath will pick up on it, but the new version of osteopaths is different than the old school osteopaths. You know,
Yeah.
it's just a way to get through medical school, where the old school osteopaths, they were a bit different than chiropractors. They did a lot of soft tissue releases and things like
Yes.
that, but they don't do it like that. I mean, there's still guys around, but they don't do it like the old days.
Yeah. Thank you so much.
You're so welcome. Keep me posted though, because this is very treatable.
I will. Thank you so much. You're giving me
so-
hope.